First, let's introduce ourselves. Obviously, my name is Dr. Manasseh.
Hi, I'm Narek. I'm an athletic training student at Caza University.
And
I'm AJ Josue. I used to play football at Humboldt State, and I'm applying for graduate school for physical therapy. Within this field, how is the longevity of being a chiropractor, and how far do you see yourself going in this field? Like, how can you work on patients that are much larger or smaller?
Great question. So my mentor, he's 57, will be 58. He's been doing it over about 33 years. He uses his hands and his elbows. I believe if you work out like I do, aggressively, I'm 41. I look like I'm probably 25, 27. I work out at least every day, or at least walk. I walk out this morning, I was walking. I have a strong core. I can do some things that most people can't do at 41. And I believe that if you can live that lifestyle, you can do chiropractic is a lifestyle. So I believe if you're active, you can go a long way. I still adjust, and I plan to adjust until I'm in my 80s if I can. You know, I'll stop when I can. But I think as long as you work out and you take care of your body, the body will take care of itself. And if you need to adjust, you'll be able to adjust. Right? And there's you got to be wise too. You got to understand there's times where I got some big guys. It may not be appropriate to use my hands. It could be my elbows. Yeah. I use more of my elbows than anything else. Yeah, there you go.
Do you believe that chiropractic limits you to a certain demographic of athletes or people or age range? Because with this, how are you supposed to mobilize a 70-year-old male?
I love it. So let's look at the word chiropractic. It's a Greek word meaning done by hand. So when we understand that, it's simply a philosophy that's based upon science of the nervous system. And what contains that nervous system is the spine, right? And so as chiropractors, we look at the nervous system and we look at how that spine is either immobile or mobile, right? To answer that question is, a 70-year-old needs to be mobilized. There are 5 grades of mobilization. There's grade 1, grade 2, grade 3, grade 4, and grade 5. It's up to the individual chiropractor or doctor to assess, diagnose, and then do the appropriate treatment plan for that 70-year-old. I've adjusted a 70-year-old who is, and I won't mention his name, but he's a Green Beret and still active. And he gets adjusted. But then I've seen a 70-year-old woman who may not need to be adjusted with that same type of force. In my experience, you learn the different grades and you learn how to, I don't like to use the word manipulation, how to adjust appropriately. But that's why I think chiropractors are needed, because in physical therapy, although traditionally used to be a grade 4, now it's up to a grade 5, we spend more time as a profession learning how to adjust and learning the spine. And I'm so grateful for that education, because it taught me how to look at someone from that perspective. And that's what makes, I think, our profession different from others. We can diagnose, we can treat, but on top of that, we can adjust, and the adjustment is so powerful. It's so extremely powerful.
Recently ran into a case of a patient with lupus, and that's what brought me back into how do you fix something like that in a clinic like this.
So with lupus, we understand lupus is an autoimmune disease.
Correct.
It's constant inflammation or chronic inflammation. The question is not about lupus, but we're looking at the biomechanics, we're looking at the soft tissue around. There's a condition, I don't treat lupus, but I do treat the individual. So that individual might have soft tissue issues.
Right.
They may have tight hip flexors. We can treat that. They might have, they might sit for too long. We can treat that. They might have some biomechanics dysfunctions for our structure, sitting at the keyboard and the computer, and their neck is constantly in flexion. So the great idea of, again, chiropractic is we don't treat conditions, we treat function. And everybody has some dysfunction going on. That's what I do. I treat function.
That's cool. Yeah. That's cool. It kind of is like a chain. Like if you have an ankle injury, you have to see where that ankle injury can stem to or from.
There you go.
Can it be your knee?
Kinetic chain.
Yep.
Absolutely. And that's the same. So think of this. When I look at sports medicine, I look at it from the standpoint of what tools do I have to bring out of my toolbox to properly treat this individual. There are moments that the toolbox only requires me to do a full exam and diagnosis. There's moments where it may require an MRI or an X-ray. There are moments that may require soft tissue. There are moments that may require just an adjustment. There are moments that might just require just us having a conversation.
Right.
Because that player, that individual needs some motivation. And there are moments that they're not a good candidate for what we do here. Not everyone is a candidate for what we do here. Now, I'm not arrogant to believe that I can fix or treat everyone. That's why we have specialties.
Thank you. Fine motor skills.
Explain that.
Fingers, small movements, chewing.
Yep. So I had an opportunity to do my internship at USC, and I worked with a lot of dentists, second year, third year, and some had neck issues and TMJ issues, and I developed a whole protocol with that. So yeah, I worked with TMJ, worked with fine motor skills with the fingers. I've had people come in here, fighters come in here with their hands or inability to, open up their fingers and stuff like that. Worked on that with my factor tool, and everyone's great. Yeah, absolutely. Cool. I do the whole entire body.
There you go.
The whole entire body. Yeah. You just gotta. It's dependent upon the patient who wants in.
That's what I
Both are humble guys. I met him actually on Instagram. He reached out to me to direct message, which I appreciate, and we had a good conversation on Friday. This is Sunday. He's back out here on his own personal time, just checking it out, and I love giving back. And then my guy here, AJ, just met him on Friday at Miss Vale, and he's a humble guy. He actually played football, former QB, and we started chopping it up about physical therapy and chiropractic. I said, "Now come to the office and let's see what we can do and talk." So you're able to kind of air hustle or listen a little bit of our conversation, okay? Appreciate it. If you want to reach out to Athletics Med or reach out to Dr. Manasseh, our information is on Instagram. Just hit the bio section, get at us, and we'll love to entertain anybody who's willing to, come out and observe. I want to give back, and this is a way of giving back to, to the community as far as sports medicine or anybody else who has a question. Appreciate you, and wish you guys the best.